Today is May 4th. May the 4th be with you. It has been a bit. I am recording on my phone because I am on bed rest. I'm not allowed to be at more than a 30-degree angle. So, yeah, I'm in recovery from surgery that I had on the 23rd. And the surgery, the day before, I did record. So this is my first recording since then. The surgery itself, we arrived the next morning to have surgery at like 6 a.m. And I don't remember like anything regarding that. I remember checking in, getting in a gown, sitting on the bed. They struggled to get the IV into my veins, but they always do. And then, yeah, I don't remember anything else. Surgery was like 10 and a half hours or something like that. I've never had a surgery for any of my surgeries that didn't involve complications because of just being born weird and the way I was born inside. Sorry in advance I don't have a shirt on, but it is very hot. And also I can't get up and down, so having a shirt on would be a little unpleasant for me, laying here like this, and the creases getting all like pressed against my back and everything. I spent a full week in the hospital, and let me tell you, waking up from surgery in the hospital with the nurses and stuff was a little overwhelming, but also I was like on a lot of medications, and so even though I was in pain, I wasn't in so much pain that it was unbearable or anything like that, but it did make me a little slow. But they were a really good team, my medical team, and it went pretty well. There was one complication, but the complication ended up thus far not being a really big deal. So yay for that. While it does seem to be impossible for me to have a surgery without a complication, at least it wasn't one that seems to be highly impactful. My roommate came to visit me every single day while I was in the hospital, and I had a friend who came to visit me while I was in the hospital. A bunch of people messaged me and stuff, and my father actually called. But for the most part, I was kind of just alone with like a bunch of nurses, and, doctors and stuff. The overall waking up, I originally was in like a catheter and things like that, but they took me off of it after like 3 days, because I was very strong. They kept telling me over and over again how shocked they were at how strong I was. They tried to have me get up out of the bed, and they gave me like this walker, and it was kind of just in my way. So I would just like walk around some and stuff, and they were like, I don't think they were expecting that. They were not expecting me to be like just walking around. I got dizzy the very first time I got up, but other than that, I didn't get dizzy at all. And even that wasn't so dizzy that I was stumbling or anything of that nature. They also had these bags on my lower legs that would inflate alternatively from each other. So they would just left, then right, alternate inflation, to help me avoid blood clots. I didn't need those very long either, because I could get up. And so they were very shocked. They were not expecting that at all. So, yeah, 3 days after surgery, they just kind of were like, okay, I guess we're stepping into the next stage. I don't know why I recovered that quickly from it, but I did. So, my arm right here that they took the skin from to create the phallus, I would say my arm is by far the most painful part of this. While some of the stitches, down around the newly formed phallus sting sometimes, especially when I'm up walking around, or say when I go to the bathroom, something like that. They can get stingy. In actuality, they're not that bad. When they get wiped clean is actually probably the time they sting the most, and that takes just a couple of seconds. It's not that big of a deal. The pain is really, really tolerable for everything to do with the phallus. What is harder is the arm. The arm just aches constantly. It never stops aching. And that's a good thing. You don't want it to stop aching. You don't want it to ever go numb or anything like that. But it does mean that there is no comfortable position for this arm. I can put it on a cloud of pillows. I can put it against an ice pack. It does not matter. It is never comfortable. That said, it's not like unbearable unless, you know, it has a heavy impact, like hit it, or say when people are changing the dressings, things like that. That's more painful. But for the most part, it's just it constantly aches, and it's really hard to fall asleep sometimes, just because it's so annoying of an ache that it just sort of follows you. Um, it is right now in a splint, and then inside of the splint is a cover, and then there's a glove, a compression glove on my hand. I have really good mobility in my hand. I also have almost no swelling in my hand. They are, again, very shocked. They're like, what the... How is this happening? I'm apparently recovering insanely well. This morning I had an appointment. I was in the hospital for 7 days, from one Thursday to the next Thursday. And then I came home, and then this morning was me coming back to the hospital for them to check on me. They said I'm healing, like, perfectly. I can't believe it. So they said that my wrist motion is a little low, but that my hand motion is exactly as it was. Like, I haven't lost any hand movement at all. There is a slight bit of swelling down here on my arm. I don't know if you can see it very well. Like, it's not that big, though. They said it might be that I permanently have a slight bulge right there, but that's it. Because it's very soft. It's not hard right there, so they think it's just a fluid retention spot. But they said even still, it's never going to be like a big deal. The one thing I will say is it's very hard to like pick things up. Like, I can't pick up my phone very easily with this arm, not because my fingers aren't strong enough, but because the tendons and stuff all underneath of the fake skin that is under there, it pulls, like, the muscles when I use them and stuff, it pulls in a really painful way. So underneath all of this stuff, the splint sleeve, and then the cover, and then the glove that compresses, underneath all of that is just gauze, and the gauze covers the actual arm, which is just a open wound basically inside, covered with this stuff called BTS that is like fake skin, and it does leak like blood a little bit through, but not like everywhere. It'll just have little seepings that come through a bit, but it's actually not too bad. It is kind of gory looking. It's kind of like this deep purple color, like if blood was allowed to be so dark that it started turning purple instead of red. That's the color that it is. It doesn't bother me to look at, but my roommate, the first time she looked at it, she like almost fainted. And I'm like, okay. She did that even though she had looked up pictures of what the arm would look like. She still almost fainted. So it can be a little much to look at. For the phallus, obviously I'm not going to take a video of my phallus right now. Even though, you know, it has some coverings and stuff. I'm just not going to do that. But I will explain, I'm okay with that, the hospital, you have like mesh underwear that they put you in that is super stretchy, and they cut a little hole in the front of it for the phallus to go through, and then you have like a cloud of gauze that gets built up as a structure around it to keep it standing straight up. You want it to be, straight on 90 degrees, like at a 45-degree angle from your body. And so, because of that, I started calling it the phallus palace, and all the nurses started calling it that. Even the charge nurse started calling it that. They all thought it was funny. Oh my god, the nurses loved me so much. I tell a lot of jokes and things like that, and they told me that I was like one of their favorite patients to work with ever, because working with me was like taking a break because their job gets so like tedious. And they said that, you know, even when they have patients who maybe aren't yelling at them or nothing like that, they're nice, but they're still serious and doing their own thing and don't really pay attention to them at all. And the nurses were like, you talk to us and you make us laugh. Oh my God, they got to where they were fighting over me. On my last day there, a nurse came in to start helping me, and then another nurse went to start helping me because the other one had gone out of the room to go get something, and then she comes back and here's a different nurse helping, and so then in the hallway they're arguing over who gets to like work with me, and kind of pissed at each other. And so the charge nurse then, who was on for the day, ended up coming and being like, are we not adults? Do not do this in the hallway at the hospital. And so she didn't let either of them work with me, and she came and worked with me instead as a punishment. My mobility physical therapist, they started me on physical therapy like pretty much right away. Like, it was very quick. Again, because I was so strong, they just were like, okay, have some physical therapy. So my hand physical therapy, my body physical therapy, my arm physical therapy, it all started like really fast. And the mobility nurses, they also loved me. I would make them laugh while they were walking around with me and stuff. And so my last day, the mobility nurse, she called out of 2 other jobs at the hospital, working with other patients, just to stay longer with me and me to keep her laughing and stuff and us to keep walking. So, I don't know what it is about me, but a lot of nurses and stuff, they were very, very just like fond of me. They were very sad to see me go. A bunch of them came back just to say bye to me. So yay for having a really great team, but also yay for having a good attitude and, being high in spirits. It goes a long way for helping not only the team feel better about working with you, but also the healing process. I had to deal with some very painful, unpleasant things like being showered by strangers and, stuff like that. It can be uncomfortable, and instead, if you are focused on how happy you are that you've had the surgery and how grateful you are to be there, it helps a lot, and you can kind of laugh and joke around about it, or at least that's what worked for me. I will say the anesthesiologist, when I came awake, the anesthesiologist person was there because they apparently want to make sure I actually woke. Because of the red in my beard, they give me a little extra, make sure I stay under. And they said that it was really adorable because I said 3 times as I was coming awake. The very first thing, when I very, very first started showing any signs of coming awake at all, apparently I said, "Is it there?" Like all excited, like a little kid. And apparently that happened 3 times before I finally was awake enough that they considered me awake. That they would move me to a new room and I would look down and I would say, "Is it there?" So it I don't know, it was super like cute to them, and I kind of think that that's pretty awesome, pretty indicative of how much I wanted this. You know, is it there? And it is there. And the thing is I always have had this phantom limb syndrome phallus issue where since I was around like 12 years old, it felt like I had one there, but I couldn't see it. You know, it wasn't actually there, but I could feel the weight of it. I could feel it. And the doctor, my surgeon, I told him exactly what size it was, exactly how it felt, exactly the girth. So I had to gain this weight and keep it up, and I had to maintain it, you know. Also, apparently, so they can seed the mons, it's better for putting the base down more solidly. But even besides that, you know, for the girth that I wanted, the girth is perfect. Like it's so on point. And they said, oh, it'll come down a little bit, but not a lot. And they're like, I hope you're okay with this. And I'm like, yes, yes, because I was scared I was going to have to do bulking surgeries, and I might not have to. And that's amazing. And also, he got it to, I think it's 5.8 inches. And my one that I felt like I had my whole life was 6.5. It's just 6.5 straight up. So it's not like the longest one ever or anything, but that's what I had my whole life, as far as my brain considered it, right? Well, usually you gain around half an inch after about a year from gravity. And so in actuality, my phallus will be almost exactly the same size as what my brain thought I had my entire life. My surgeon did such an amazing job. I'm so freaking happy with it. And the electrolysis, let me tell you, it was agony going through how long electrolysis took. The pain of electrolysis didn't really bother me, but the time consumption bothered me a lot. But my phallus is like perfect. It's so soft, and it's so like perfect. Like literally, I have zero complaints. Now I can't see the very bottom of it, and the very bottom of it is where the complication was. There wasn't enough skin from the skin taken from my arm itself to fully close, so they did have to put a thin line of the BTS along the bottom of it, but they're gonna be able to replace that with some skin from my thigh later, so it's not a big deal. On the 29th, I have another surgery where I'll be overnight in the hospital and stuff, for skin grafting from my thigh onto my arm and onto that little bottom strip there. I'm not too worried about it. It'll be fine. It's pretty thin, and also, I just literally couldn't be worried about it. Everything else is so exactly perfectly, like literally what I wanted. I also, like I had said before, got lucky and got the microsurgeon who could do the groinal attachments. I have two vessels and an artery. I have full blood flow in my phallus. Like, and all of the microsurgery nerve attachments, I can already feel them in my, groin. Like I can literally feel them. They hurt some, especially if, my right leg where they're more attached on that side. If it bends too much, I can feel it for sure. But today at my appointment, everything is perfect. Everything is healing perfectly. It's all going freaking well. It still hurts. Believe me, I am in pain, but I'm not in so much pain that I'm taking all of the medication. The painkillers, I got given, some oxycodone to take, and they're in little 5 milligram pills or whatever. I don't eat. I'm allowed to take up to 15 milligrams worth a day, and I have not a single day. So I haven't needed it. I'm only doing fives. I'm not saying that because if someone else needs it, that they should feel bad. I'm just saying that for me personally, my healing is going extremely well. I'm just saying it's going awesome. Um, my phallus, keeping it upright in the upright position, it can make things a little awkward. Uh, because it looks like I have a full on Woody when I put on like even loose shorts or like really loose pajama bottoms. Even then, it still looks like just a full on hard on. So I'm supposed to take walks. And my very first walk, I was going with my brother out walking outside, and a guy walked up to us and started talking to us, and it did come up. Um, it my brother was like, "Oh, people won't even notice. Don't worry about it. No one's gonna look down." No, it came up. I just said, "Hey, I've had surgery down there recently," and the other guy, the random guy who had started talking with us, he was like, "Oh, cool. I hope you have a good recovery, all that stuff." So it was fine. He, we all chuckled about it or whatever, but I was very glad that it was a guy and not a girl because I'm like, at least he's probably not like uncomfortable or something. But it is a little weird walking around with like a full hard on. My phallus does not fully look like exactly like everything. The very tip of it is not finished. This is partially so that everything can heal for the urethral lengthening before they finish that. And it is also partially because it's better to just let a lot of healing happen before the final shaping of the tip. And so it's just covered in zero form, which is this really sticky, um, I don't know. It's almost like it's covered in like oil or jelly or something. A gauze. It's like a yellow gauze that's like really moist. And so the tip of it is just covered in that, in a rectangle of that. And I have to change the dressings once a day, change the gauze and the mesh underwear once a day, change the dressing on the arm, the gauze there underneath the arm. So all of that stuff, it's a little frustrating that you got to do it every single day, but you're healing. And when you go do all the changings, it's good to get cleaned up. We have some baby wipies we got, lifesaver. Uh, we also have a detachable shower head, lifesaver, because my back and from the thighs down can be showered, and then the rest of me can't. So it's just been a lifesaver to have those. During top surgery, I could not wear deodorant while I was healing. Being able to wear deodorant this time is life saving. It helps so much. I would say the worst part about all of this is those few seconds when you're getting up off the bed and back onto the bed again. Every single time it hurts, and every single time you feel a little scared because one fall is all it would take, and everything feels like it's over. I did have one slip and almost fall, but I did not fall all the way. So I definitely feel some trepidation about getting on and off of the bed. The other thing that's uncomfortable or unpleasant, or however you want to say it, is going to the bathroom. Because there's just so much gauze, we basically have me take off the mesh underwear and all these fluff clouds of gauze, and except for one. And then that one single fluff cloud of gauze is under the bottom to help hold the phallus, and you have to hold it up while going potty, and then you have to lift and reach under to try to like wipe and stuff. We have a bidet on the toilet that helps, but you still gotta use baby wipies and clean. So it's pretty uncomfortable. Not the best, but it is temporary. It is a temporary discomfort for a, you know, possibility at decades of happiness. And I already am so happy about the surgery. Like, The the complication doesn't bother me. Everything else is just so good with it that I just can't be unhappy at all. Um, Not everything is done. There's still more surgery to go and stuff. It's being done in a little bit extra staging because, again, of my history of complications. But yeah, I'm just sort of laying here watching shows. I am allowed to eat and things like that. Um, it's pretty fine. I did, while I was in the hospital, I got nauseous and I did end up vomiting. I got nauseous more than once. I dry heaved, but I only vomited once. The nausea from eating too fast, that was a little rough. We went a little too quickly, I think, because of how strong they saw I was with the walking around and stuff. We went a little too quickly with the moving me onto solid foods, and so yeah, that was a mistake. Go easy on yourself if it's you. A lot of those meds and stuff for surgery, if it makes you nauseous, don't keep going. Don't push yourself. Um, that's something I would definitely say was uncomfortable, because believe me, dry heaving and using all your torso muscles involuntarily like that while you're covered in stitches down there ain't pleasant. It's not. So, yeah. I also made the mistake of watching a super funny movie. That was interesting because I was really enjoying myself, but I also, you feel it when you're laughing like that. So maybe don't watch any horror films and don't watch any comedies. Don't watch anything that you're going to have super strong reactions to, because you are going to maybe activate some muscles down that, in your torso that are going to make some of your stitches feel maybe a little unpleasant, but it's pretty okay. I do have a little bit of side sutures. They were for the Doppels. The phallus, since they put in three, two blood vessels and an artery, they had three Doppels coming off of the side of my lower belly, and they were connected to these wires that went down into stuff. The wires are technically still in there until May 29th, but the sutures around them and everything are all healing just fine. And yet they were covered with this sticky plastic stuff called like Tagaderm. It did split open at one point and more had to be put on, but they seem to be doing fine just ever since then. And it's healing really well. I have no infections or anything like that, so knock on wood that continues, knock on wood. I am leaning on my wedge pillow. I'm not allowed to be at more than 30-degree angle, even after going home. Like, you're just not allowed. So I cannot recommend enough to anyone who may be considering phalloplasty for themselves. A wedge pillow really helps a lot. Mine is one that can be broken into different shapes so that you can change the level of the angle, and that helps a lot. Because for my top surgery, I could sit up leaning against it, and for this surgery, I'm now leaned down leaning against it, and it works out either way. So I have more surgeries to go. I'm sure I will use it in more ways. I can definitely say good money investment. Something that's really helped a lot also is the insurance, thankfully, is covering a lot of the medical supplies. And so the hospital gave us a bunch of supplies, and then also insurance is going to have some sent to our apartment, which is like, phew. Because, again, you go through 4 piles of gauze. You kind of fold a full roll of gauze into like an accordion. So just back and forth, turning it into a fluffy cloud. The first 2 days I was basically on like fluids and stuff, and then I got moved to food like right away, and that was a mistake. So after that, it was a couple of days of being on like applesauce at the best, and I think that was 2 days of applesauce. It was worth it, believe me, because when I went on solid food again, that's when I vomited, and so they did like this stair stepping thing after that, and it worked really well for going back onto solid food. I did have trouble with constipation at first coming from the surgery, but they gave me one single suppository and it cleared things out, and it's been going just fine ever since then. I honestly would say it was a relief to not have like diarrhea mode anymore. That lasted for like 4 days and was not fun. But let's see, is there anything else? I do bleed down there some. There's like pads that the hospital gave us for the bed for me to lay on, because I do bleed. But the bleeding has receded significantly. They said the worst of the bleeding was going to be the first 2 days after I got home, and that was very true. I didn't bleed all that terrible much in the hospital, it didn't feel like, but when I first got home, it felt like I bled down there quite a bit. Now that I've been there been, at home for a few days, the bleeding feels like it is receding quite a lot, which is a relief. They originally have like a drain pipe thing in there, and right before I left the hospital, they pulled that out and did like some suture cuts and things like that and stuff. So those specific stitches are the ones that like hurt the most. But I have dissolving stitches that are in my body, so they're gonna start dissolving soon and stuff like that. And then I did not have to have staples in my arms. They actually sewed, and I am so grateful because this the surgical scars are way significantly less bad, and B, it apparently the staples like catch on stuff and things like that. The nurses said that when they've had to work with staples versus stitches, it's just so much worse. So, yay. I really, really am super grateful for the entire like surgical team, for real. I'm also super grateful to my roommate who has been a trooper with helping me each day, and also my brother came and helped me one day. Um, at first, when I got home, it I couldn't quite go to the bathroom by myself. Not like the potty part of it, but like actually making it to the toilet and like sitting down and being able to, you know, move, the actual moving around part. Getting up and off of the bed could be quite difficult. And so I really am grateful to anyone and everyone who's been helpful. Um, I'm so grateful for my phallus. I have felt so much better about my body. And the thing is it's not finished. It doesn't, the tip of it completely still just covered in zero form. Like it does not look like a phallus on the end at all. And here I am covered in like wounds. I'm in pain, and I don't have like, balls yet. I don't, I don't even have like the skin grafting stuff done yet. So happy. Could not possibly begin to explain how happy I have been. I have had like pretty severe iatrophobia most of my life, if not all of it. Certainly as far back as I can remember, till like 3. And after the surgery got done, people were like, "Oh, I'm so sorry. We're gonna need to, like change your dressings or touch stuff." And I was like, "Okay." It was like it was just gone. I was just like, "Okay." They like would poke and prod me, and I wasn't uncomfortable at all. And like this is in my medical records that I get very anxious about stuff like that, and I was fine. And I was just like, "Wow, is this what it's like to be normal?" I just was completely fine. And I don't even begin to know how to explain it. Something I will say that's very weird, just laying here at home and stuff. I haven't been home very long. I got aroused for the first time. Didn't have any ability to do anything about it, but I definitely still have the kind of sensation down there. It has not gone anywhere, so that's a relief. Now, I can't do crap about it. It was weirdly like, cause again, I'm covered in stitches and it's painful, uh, but at the same time, it, it was very strange. Nothing happened because again, I can't do anything. I'm covered in stitches. I'm just saying that was a relief to find out that all of the nerves that are underneath, they're all still definitely there. It all still apparently works just fine. So, hey, if anyone was ever worried about that, it doesn't go anywhere. Now, can I feel up into the shaft of the phallus? No, I cannot. But it's interesting when I feel. I remember the first day the nurses let me hold my own phallus because I got so excited because it felt exactly the weight that I thought it was going to feel. Like my brain was expecting to feel the weight of it in my hand, and it was exactly that same weight. And again, it's the right girth. It's my surgeon did such a good job, but I can't I can't even express the the way that this has diminished the 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 dysphoria that I have had like my whole life about my body, and it not being right. It's just like mind-boggling to try to express. It's just I've definitely been super happy, like very happy. So even though I'm in pain, and sometimes the pain is so bad, I'm like, oh my god, please, when can I have Tylenol again? When can I have Tylenol again? Like sometimes the pain has gotten like that, but not that much, and totally worth it. Completely worth it. I mean, it's barely been any time since I had surgery, and it's already totally worth it. So thank you, thank you, thank you to any and everyone who's ever been supportive, because um, I might have been born intersex and surgically altered without any say in the matter, and that sucks. And my whole life has not been pleasant in a million different ways, even besides that. But this surgery, the surgery will hopefully be the start of like a whole bunch of healing that has nothing to do with like stitches. And I'm whole, like for the first time in my entire life. There's something there's something that is missing without that kind of confidence that I don't know how to explain to people who have genitalia. To go my whole life for decades without genitals, and to have it now is it's like a miracle or something. So even though it's painful, I'm not gonna deny that at all. It's completely worth it. Like seriously. Um, it is weird getting around with one right hand that works pretty well and one left leg that works pretty well, and then my right leg, it would work pretty well, except I need to keep it pretty straight in alignment with my right hip so that I don't mess up my microsurgery that got done. Um, so it is weird getting around because my left arm, obviously, I can't do crap with it, and my right leg, I can't really do stuff with it, even though it would be capable of it. And so I have to pull myself with my left arm and push, or I mean, with my right arm and push with my left leg, like it's a little weird, but you get used to it. I've also gotten used to opening things with my teeth and my right hand instead of being able to use my left hand as easily for opening things. Something they started having me do like almost immediately though was ordering food at the hospital that I could pick up with fingers and picking up the food with these fingers. Sorry, they're slightly orange. They still have some dyeing in them, like from iodine around the fingernails and stuff. They've cleaned my hand multiple times, but apparently it was a lot of iodine. They used an entire tub of glue to seal the BTS of first and stuff with these black sponges that were suction cupped to do it. And let me tell you, when they removed that HVAC that was around my arm, that's probably the most painful part of this entire process that I experienced. It was a lot. And I have some arm hairs, so it ripped them all out. And then on top of that, it just hurts. Like, it's a very painful experience when they pull the HVAC off your arm. But it's survivable. It's funny. One of the nurses, I was laying there, I was cussing a little bit. It was painful. They were like, "Oh yeah, cuss if it helps it feel better." And I was like, "My ancestors had battle axes on bloody battlefields. I can handle this for 10 minutes." And I made her laugh pretty hard with that one. she was laughing pretty hard. I was like, 10 minutes of excruciation. I can do it. So. But yeah, it was not fun. So when they pull that HVAC off your arm, prepare yourself. Have taken your oxycodone or whatever they put you on for medications. If you ever get this surgery, if you ever get phalloplasty, radial forearm flap, okay, RFF phalloplasty. It's time to pull off the HVAC. Make sure it's scheduled for like an hour after you took your painkillers, because it is not fun. It hurts for sure. But the rest of it, it's all been pretty survivable, and everybody has been really kind at the hospital. And yeah, there was a bit of a scare. Those Doppels that were attached to me, they were listening to the blood vessels in the artery that is in my phallus, and two of them stopped making sound. Now, let me tell you, they're loud. I kept joking that my phallus controls the weather because it sounds like a whirlwind. Like, it sounds so loud and like it's very loud. Anyway, two of them stopped making sound, and so I've always had small vessels. My vessels have always been a little bit annoying in the first place. They had to use an ultrasound to get my IV to go in and stop being torture for me, because every time they tried to poke me, they'd have to poke me over and over again. They had to do my palm to draw blood. They had to do like everywhere. They were like, "Oh my god, your arm is getting bruised, and we only have your right arm to draw from. We need it to be like functional, because we can't go to your left arm. Your left arm's in a splint." So, my vessels always have been like that. Every surgery, it's just usually there's two arms to work with, and this time there was only one. So the doctor said that my vessels very likely could have moved after the swelling came down, but also they used, I guess, what's called a pencil, but it's like a really skinny rod of an ultrasound thing, and they just went ahead and felt along the side of my phallus until they found each one, and they all still sounded good. So it was scary at first because I was like, "Oh no, did my microsurgery not work?" But apparently it did, but the wires themselves wore out after a couple of days. And the one wire for my artery, man, that one never shut up. Till the moment I left the hospital and they cut it off, the connection and put the seal over it, like all the way up until that very moment, my artery never stopped sounding like a windstorm. So that was the one, I guess, scare or whatever. But it wasn't actually a real scare because nothing bad actually happened. But believe me, my surgeon came in and he was like, "I need to listen to all this. I need to make sure nothing bad is happening." But yeah, it ended up being that nothing bad was happening, so it worked out. Um, I will say it's a lot easier to get on and off of a bed at the hospital. The hospital, the bed can be lifted and moved around and tilted and all this stuff. At home, your bed's just a solid bed, and the difference is definitely noticeable. Also, at the hospital, you have a lot of people coming and checking on you all at this a lot, especially, oh my god, the whole first night, on the hour, every hour they checked on me, and then after that it was every 2 hours, and then after that it was every 4 hours, and finally I could get a little sleep. It's difficult. It is very difficult to get some sleep, and the whole first night, every time I tried to sleep, it would just be nightmares. And so it was a horrible time because I just could not sleep. But if you can get through it, you eventually get to go home. And at home, you actually do get to sleep. But the problem is you've gotten so used to being checked on every 4 hours that you kind of wake up and you have to like convince yourself to go back to sleep because yeah, that's the one thing that really has lingered is that I still am waking up every 4 hours as if a nurse was going to come in here. So that's a little weird, but I'll adjust. I don't have an appointment again until the 19th, and then surgery is the 29th, so I don't know when next I will record, but I figured I better do some sort of recording about surgery. Um, so I'm sure there's a lot more. There's so much more I could say,